Hello families, this is Dr. Alberto from Rehealth and World Stem Cells Clinic here in Cancun. Today I'd like to talk about coronavirus, or the so famous COVID-19. Well, as you know, there is a lot of information available out there, very useful information. But also there is very useful information that is currently being misunderstood, and this is leading to some anxiety, fear, and in some cases hysteria. Now, let's split the situation in two groups. Group number one is the group that is not that sick. This is traditionally the population that may experience basic initial symptoms like cough, mostly dry cough, maybe body aches, perhaps the sensation of shortness of breath or mild shortness of breath, maybe a peak of a fever. Very similar like having a cold or maybe a flu. This is the type of population, or this is the group that is going to feel better, that is going to overcome the symptoms in a matter of maybe a week, perhaps 2 weeks. On the other hand, we have the other group, or the people who is very sick. This population is the one that is being hit, mostly elderly people, people who have some form of immune deficiencies, people who has a history of blood pressure problems, diabetes, lung disease. In this type of situation, or in this population, what happens is that the infection causes some form of pneumonia, and this pneumonia is acting as a barrier, impeding or blocking the proper exchange between CO2 and oxygen. What this is going to happen is it will transpire into some form of oxygen saturation drop, a lot of shortness of breath, and this is the point in which ventilatory assistance will be needed. Now, at this point is where the situation gets critical. Why is this? Because other co-infections may occur. Now, let's note something. The virus, the COVID-19, is not the one that is causing the death of the people. People is dying because of the complications that it's happening because of the virus. Now, to sum up, if you are struggling or if you are experiencing with some initial symptoms, once again, dry cough, a peak of a fever, body aches, mild shortness of breath, please stay at home. Do not go outside. Do not pack the hospitals. Do not go to the doctor. What you can do is take the necessary isolation methods at home. Take the necessary hygiene methods at home. You can call your PCP. There are a lot of phone numbers that you can reach, and they can provide guidance in order for you to identify or to teach you how to identify red flags and how to overcome them. Finally, if there is a question, feel free to contact us. You know how to reach us, whether if it's to our email addresses, to our phone numbers, or simply you can send us a message to info@advancedbiomedicine.com. You know how to reach us. Please stay home, stay safe. Have an excellent day.